Well, good afternoon, everyone. I see folks are still trickling onto our call today, but it is 1 o'clock Eastern, noon Central, so we can go ahead and kick it off. And I'm sure more folks will continue to hop on here as we move forward. So my name is Kelsey Ostergren. I'm joined by my program co-lead, Jerry Hinneker. And I also see we have a few other Superior Health staff on the line. Julie Campbell, who will be facilitating our discussion, and then Allie Conlon, who will be actually giving our presentation on well-being for today. So just a couple quick reminders before we get started. So for those of you that were here last week, we did transition to this new hour-long education format. Again, the first half hour is really our education, and then the second half is that just kind of open Q&A. We will start the Q&A with questions related to the presentation, but really that is your chance to ask any COVID-related questions you have, get feedback from your peers and support. So we're just really encourage you to use this time to your benefit and ask any questions that are on your mind. The slides for our presentation today will be available. I see Jerry just dropped the link in chat. Thank you, Jerry, for doing that. And then we will also, as we do every week, share an evaluation link. So if you could just take a couple minutes towards the end of the presentation and fill that out, we would really appreciate it. A couple other quick reminders before I turn the floor over to Allie. I just wanted to give one final reminder about the resident stories. We are still looking for these. So if you have anyone from your facility that you think we could highlight and just really promote this, we would welcome your feedback. I see Tony Kettner's on the line today as well. So she is our point of contact for this. If you have questions, please reach out to her. Feel free to chat her in the chat box as well if you have other questions or want to just pick her brain. But the deadline for this is next week, Thursday, so April 28th. So just wanted to provide one final reminder on that, as we are really wanting to highlight the work that you've done and share your specific stories. The other thing that we keep coming back to is this CMS scenario-based training modules, which are available on demand for free to all of our nursing staff. CMS, we understand, is monitoring compliance with this and are really looking for 75% of nursing home staff to complete this. So we want to make sure we are sharing that with you. We would highly encourage you to disseminate this to your staff. And again, you can complete this as a group. So just thinking through what that could look like for you, how you want to go about this. The ball's in your court, however it makes sense for you, please feel free to do it. And again, we have contact information for Christy here on the slide and her email address. So please feel free to reach out to her if you do have any questions or comments on that. All right, so with that, now that I finished our housekeeping announcements, Allie, I will turn the call over to you. And we are so glad to have you and just hear a little bit about what you have to share today related to workforce wellness in the long-term care space.
Yeah, thank you, Kelsey, and thank you for having me. I am working with Superior Health, and I actually work out of the Minnesota Hospital Association as a quality improvement advisor. I come with a few years of experience working as a long-term care administrator, and so that's the lens that I'm going to be looking at things in today. And some of the goals of this presentation about the mental health and emotional well-being of those who work in long-term care environments really are to provide some best practices for you all and some resources, and encourage you as leaders in long-term care, and give you those tools and resources to use to encourage your staff members, and at the same time reinforcing that it is okay to fail when it comes to working through some of these best practices and resources. Some of them may need to be altered or changed to your environment and to those staff that you serve and that work in your facilities. Not all staff base is the same. So realizing that it is okay to make some changes to some of these things that we're going to present on here. And some of these real life stories that I have to share are just some examples and things that I've experienced during my time as an administrator. So next slide, Kelsey. I'm starting with what is emotional well-being, just to provide the foundation and framework around this presentation. And it really does refer to the emotional quality of one's individual experiences. And that's really important to realize and to understand that each individual's experience is their own, and it will be different from the person next to them and from yourself as the leader. And There's 5 ways here to promote an individual's emotional well-being, your own or somebody else's. Connecting with people is a very good one. Being physically active, getting, that 30 minutes or more of exercise per day and taking a walk on your lunch break or things like that. Learning new skills and teaching yourself new things or learning new things, helping others learn new things is another way to promote that well-being. Giving to others, not really just financially or giving of things, but giving of time, giving of your listening ear, giving of your just presence of being with someone really does impact their well-being as well. And really just paying attention to what's happening in the present, being mindful, really focusing on what it is that you can control and the here and the now of the situation. And emotional well-being really is influenced by a lot of different areas, psychological, demographic, economic, different situational factors that you and the building that you serve and the staff that you serve are going through. And the COVID-19 pandemic really was a big deterrent of every human being's emotional well-being, and especially of those of us working in healthcare and in the long-term care settings and our residents and their families. And so this is really a key topic to kind of focus on as we continue with the never-ending challenges surrounding the pandemic. So next slide, Kelsey. So some of these best practices will include checking in with your staff. So you can slide to the next one. So check in with your staff, provide that check-in for your staff members to really share how they are doing. This "How are you feeling" poster on the screen will be included in the resources, as well as this check-in board. And provide these resources and tools in employee areas in your facilities, and really let your staff share how they're feeling. And these are just a few tools that can be utilized, but they are just those that you can invite your staff to share. They don't put them on the spot or require your staff to share, but these are really good tools that you can start with and check in with your staff. How are they doing? And if you get a overwhelming response of negatives, then that might be something to look into further and with your facility and with your staff members on. If a lot of people are really struggling right now, then maybe you guys need to do something that lightens people's spirits and kind of brings some happiness back into their lives. And a few other examples of things you can do for checking in with your staff really are kind of simple. Holding huddles at the beginning and ending of the shift day, or the different shifts that you have during the day, the AM or the PM, or even coming in for overnight and holding a huddle to have your staff be able to express their thoughts and concerns and feelings about things that are going on in the facility and outside of the facility. Providing that time and space to mourn the losses for employees and for them to be able to take those breaks that they need and really share their emotions when it comes to those losses that we do experience, especially working in long-term care settings. Another really key thing that I know I practiced as an administrator was normalizing HR-related programs like the Employee Assistance Program. I know myself as a former administrator really took advantage of the programs that my organization had to offer myself as a leader and utilize them, and they impacted me very positively. And so that was always a resource that I promoted to the employees that I was working with. As always, we provide that education and training on multiple different topics throughout the different months and during the year for our staff members, but focusing on different things like stages of grief and different support groups and individual groups that can come together to talk about varieties of topics. I know as a former administrator, we would have a clinical psychologist come in and see our residents on a pretty regular cadence. And we also asked this individual to come in and do educations and seminars and really some open forum sessions for our staff members. And this was especially influential during the last few years with the pandemic to talk about varieties of topics from, resident behaviors that we really didn't understand or know how to grasp, but also things like how to cope and the different stages of grief and maybe explaining Alzheimer's and dementia from a different lens. And this was really mutually beneficial to our residents and to the staff in the building that I served in. And it was just nice to be able to tie everything together a little bit better, but also really provide that space, that safe space for our employees to ask the questions and share the things that maybe they didn't know how to with working with their residents or their coworkers on the floor. And I know another thing that I really did practice as an administrator was that open door environment where expressing the feelings and emotions that us as staff members working in long-term care felt was normalized. And yes, there is a time and place for an administrator to close their door and, work on important topics or confidential matters, but it really went a long way with the staff members that worked in my facility to know that myself and the other administrative staff in our office area really were always there to listen and to hear what they had to say. That goes into the next topic, if you want to go to the next slide, of compassionate communication. This is another kind of strategy and best practice you can use to promote the well-being of your staff members in your different buildings and facilities. And it really does direct people to focus on their observations and feelings and to ask what they need to address the stressors that they're experiencing. This type of communication really does help people respond to themselves and also respond to others with kindness, and really can strengthen working relationships amongst you and your employees. It goes into the 4 steps above with the observations, feelings, needs, and a request. And as supervisors, we really can respond with, really attuned listening and communicate both verbally and non-verbally with our staff members, and listen to them and respond with, I do hear what you're saying, and I'm very sorry that you're feeling this way. And when they express their need and their request, then figuring out if that's something that we can do for them as a supervisor. This really does require fully hearing your staff member out and not coming with an agenda or something else on your mind, but really letting the individual come to you and go through these 4 stages of communication, and then responding and seeing what you can do in response to the need or the request that this employee or group of employees may be bringing to you. As leaders, we also can provide training on staff on varieties of topics to staff to promote this culture of kindness and compassionate communication. And some of those topics of education could be things like active listening or customer service trainings, or the ongoing staff trainings that we all have in our different buildings of Alzheimer's and dementia care and caregiver support. And I think more than that, caregiver support is one of those really highly important topics, especially after these last 2 years that we continue to go through. Leaders really can be that model of this compassionate communication during all sorts of meetings, staff meetings, daily rounds, daily huddles, different things where you are present as the leader and can really express and show that this compassionate communication really can go a long way. As a former administrator myself, I have had multiple stories and multiple examples I could have shared with you guys, but one that really does stick with me and resonates with me is a staff member came to me and expressed their concern with being able to, with transportation. And transportation can be a big issue with staff members depending on where your facilities are located. And mine just so happened to not be on any public transportation lines or bus lines or anything like that. And she was a full-time employee working with us that had worked with us for quite a long time, but also was a full-time caregiver at home to a mother that really needed her whenever she wasn't at work. And so her missing work wasn't really an option for her. And she really did rely on that transportation that was available to essential workers during the pandemic. And when that came to an end, she didn't really know what to do. This was her full-time role, and she needed her job, and she was a very good employee with us. So we talked it all through. She really came to me with steps 1, 2, 3, and 4. And we went through this compassionate communication together over multiple weeks. And I did all that I could in my power as the administrator to pull my resources together and my organization from a corporate perspective, has an employee assistance, employee appreciation foundation that has funds in it that we were actually able to draw from and assist her with a down payment for a vehicle. So she kept her job and we were able to keep a very good employee and help her out because she felt that she could come to me and kind of state her observations and feelings and express her needs and requests. And I was able to respond and actually help her out, which was a wonderful feeling in the end. Next slide, please. One of the most important things I think that is a very good best practice or strategy in regards to well-being is celebrating the positives. I know that's been challenging for all of you for the last few years, but I think it's key in keeping the emotional health and spirits up of your staff members that you're working with on a daily basis and the employees that are working in your buildings. Reinforcing that it is okay to have fun at work again and provide space for that laughter and celebrate those important birthdays and anniversaries and milestones that your staff members and employees and even your residents have made over the last few years and, you know, on a month-to-month or day-to-day basis. I think one thing when it comes to celebrating the positives and with any of these strategies really is knowing the audience that you have, knowing your staff base and, you know, knowing what they respond to, what backgrounds or cultures do your staff members come from, and really as the leader making it known to them that you want to know and you want to understand their needs and their wants and what things that they want to celebrate. Like I said before, it is going to take some trial and error, and it is okay to fail on some of these things and kind of restart and redraw from the ground up. I know one simple thing I did as an administrator was I put together a simple snack cart, and you know, who doesn't like food? And so I think they responded very well to that, of different snacks and drinks and things. And during the winter months, I made sure to include some lotions and hand creams and chapstick because here in Minnesota, where I'm based out of, it can get very, very cold. And so just things that they would need and really benefit from having. And I made it a point for multiple times during the week, trying to hit all 3 shifts that I would walk around with this snack cart and really have a touch point with all the staff that were working on that shift or on that unit on the day that I walked around. And this really gave me the opportunity to connect with the staff members that were working, but also it gave me time to, you know, really refill my bucket as an administrator, connecting with people and seeing the residents on the floor really always reinforced why I did what I did. And it was also really good to be able to check in with the staff members and be able to let them see that I'm on the floor with them and I knew their challenges and their successes with different residents and different situations that were going on. And multiple times staff would come to me and say, you know, thank you for being on the floor. We really think that you hear us, you understand, and you see what's going on in the building. And it really gave me the lens to see things that if they needed to be changed, I would be an advocate for them and help with that improvement. Next, please. Last but not least, one of the most important strategies that I, as an administrator, really could have utilized someone presenting to this topic to me when I was serving in my administrator role is making sure you're caring for yourself too. Taking that time for self-care and some of those self-regulation activities is really important with our roles. The challenges and the different obstacles that come up on a day-to-day, sometimes hour-to-hour basis really can take a toll on a person's overall health and mental well-being, and really embracing what it is that you can control as the administrator, because there really are some things that are happening that we can't control. Some different rules, regulations, policy changes that come at us that we don't really have any idea they're coming. Really embracing what you can control is really an important topic in regards to caring for yourself. Find that time to take a 5 or 10 minute walk outside when it's nice out and maybe there's no snow on the ground that day, or, you know, starting meetings with series of relaxation or deep breaths, or creating those opportunities to laugh together. And, laughter really can release those stress hormones that every individual has. So creating those different environments when you're, leading a meeting or starting the day with your team, just to ensure that we as caregivers, we tend to prioritize the care and the capacity for those that we serve. As myself, as an administrator, I really always put my staff before myself. And this can really take a toll on somebody in a leadership role like we are all in long-term care, reminding ourselves that there are many, many things that are happening right now that are out of our control, and embracing really what you can, as I said before, and letting go of what you can't. And you can always come back to the point of the one thing that is in your control is really encouraging your staff to take care of themselves too. I know that a small, simple thing that I practiced on a daily basis when I was an administrator was making sure that I ate lunch every day. And that can really be something so little, but it made the world of difference to me with my mental and physical health. And, getting up from your desk for 20 or 30 minutes of the day and resetting and refreshing, making sure you're energizing yourself with some food and some water, and then starting the work again, because it's going to be there when you come back from lunch. We all know that it'll be there when you get back. So something small like that really made a big impact on myself, my mental and emotional health, and my overall productivity with work when I was serving in the role of administrator. And little things like that you can do on a daily basis really will make the biggest impact in the long run. The next slide is the resources page that will be included in this slide deck when we send it out to you. Please, let us know if there's anything that you need access to, and any questions you may have. But this really is the end of my presentation on mental health and emotional well-being, and I'd be happy to take any questions or comments at this time too.
Thanks so much, Allie. I don't see anything in the chat box yet, but while folks are thinking and, kind of formulating responses, feedback, thoughts, what this generates for you, one of the things I do just want to call attention to is this ARC link that's kind of in the middle of this resource slide. So this was something that we stumbled across and has really a wealth of resources there. In a variety of different topics, formats, different examples, things you might take, use, and adopt. We didn't want to show every single one of them. We felt like that would just kind of hijack the whole call. But I really would encourage you to spend some time looking at that and just looking at the resources that are available. To Allie's earlier comment, it's really going to be important that as you're looking at these resources that you understand your environment, your staff, kind of where they're at and what things really might resonate with them now. And as Allie pointed out, right, don't be afraid to try something. If it doesn't work, that's fine. Try something different, try to launch it in a different way. But just because you do it and it doesn't work right away on the first try, don't give up, right? I think we've all been through, a crazy 2+ years with COVID, staff challenges, mental, emotional, physical exhaustion. And so this really is a time to build ourselves, our staff, our teams back up. And so again, just kind of wanted to draw attention to that. Take a look at it, see what sticks out to you. If there's something that maybe is very specific, but you feel like that could fit a need that you've seen in your facility, would just encourage you and invite you to take this as your nudge to potentially try something new and see how it goes. So there are other thoughts or reactions to what Allie has shared, or questions that people have about any of this content, how it would look in practice, how other facilities have done it. I know we've got a handful of folks on the call today, so I just invite you to share any thoughts or feedback you have at this time.
And if people prefer, they can chat their responses into.
Absolutely. Thanks, Jerry. So I'm not seeing anything come through yet. So Julie, I'm going to pass it off to you and maybe you can share some of the questions just to generate some conversation for our group today.
Yeah, thanks, Kelsey. And thanks to Allie too for your presentation. That was some great perspective on strategies that you've used. And it was great to hear that personal experience. Like Kelsey had mentioned, this next part of our call is really for all of you, the participants, to kind of network and talk about the experiences that you've been having. We'll go ahead and open this up. If you do have any questions for Allie about her presentation, feel free to send those in or unmute yourself. And then also this kind of portion of the call is really just an open forum. So if you have any questions about COVID-19 or you want to talk about anything related to COVID-19 vaccines or boosters, feel free to send any of that in too. But I did have a few questions just to kind of get some discussion going between all of our participants today. So I know Allie outlined quite a few really good strategies. And one of the things that she said earlier in the presentation was that one way to promote emotional well-being is connecting with people. And so we're just curious, what ways have you connected with your team and your residents during the day? And have you seen any changes to that maybe throughout the course of the pandemic? Or have you come up with any new ways to connect with your staff or with residents? So I'm going to go ahead and pause. And again, you can enter that in the chat. You can go ahead and unmute yourself, but any ways that you're connecting with your team and residents. Looks like we have a bit of a quiet group today, but I think that's the benefit of gathering everyone together like this is if you don't have something going on right now and you're kind of looking to get more into this space, maybe share something that you'd like to try, or if there's something that is working for you that may be really helpful for another facility on the call that's kind of looking to get into this space. So any ideas, any successes, maybe even if something didn't work out, just those ways that you're connecting with your teams and with residents. So I know one strategy that Allie had mentioned too that I think relates to connecting, especially with staff, was that ARC resource. And I know Kelsey talked a little bit more about that too, and that check-in board resource. So kind of asking people to identify how they're feeling, if they're feeling thanks, yep, if they're feeling great, all the way to I'm needing some support, maybe I'm struggling right now. So I'm curious too, has anybody on the call tried a strategy like this before? Or maybe did you try something similar or you adapted something like this to use with your teams? Anything that you're doing to check in with staff about how they're feeling?
And Julie, just to piggyback off of that, even if you're not using something really formal and structured like what is shown on the screen, what does this look like for you? How are you as a director of nursing or an administrator checking in with your staff? What does that process look like?
Looks like we do have a comment in chat from Lynn. Even before the pandemic, I've always found that the best way to connect with staff is a daily huddle at the beginning of their shift, listen to their concerns, and then most important, act on what you learn from them. That's such a great comment. Thank you for sending that in, Lynn. And that sounds similar to what Allie was mentioning too. And just that power of really connecting with people, hearing what's going on for them, and then doing what you can to address their concerns. Absolutely. Thank you for sending that in.
And the other thing that Allie shared, which I really resonated with, was that request piece, right? So as you're having some of these conversations and you're listening to things that are being shared, if people don't explicitly state, I need X from you, how do you sift through what you're hearing to identify and maybe verbalize back to them? So what I'm hearing from you is, and it sounds like you would like me to, right? So that we can sort of reiterate that of, am I understanding you correctly? Would it be helpful to you if I did X? Just so that you're kind of tying it all together and really demonstrating that active listening. And then I think, Lynn, you're totally spot on. If we're listening but not acting on it, over time, that repeated pattern is going to be demoralizing because people know that if they elevate those concerns, nothing is going to happen. So I think you hit the nail on the head with that one, and it really is going to be important that we do something with the information that we heard, even if it's just acknowledging, I heard you, I'm working on it, I'll let you know what I find out, or I'll let you know when I have an answer for you. And I don't know, Allie, if there's anything you would add to that.
No, Kelsey, that's a great point that you make, is sometimes the staff members will come to you and just unload everything to you. And maybe it'll be number 4 first, and then number 1, number 3, number 2. And it's not going to be in this like beautiful 1, 2, 3, 4 pattern, because there's a lot going on in your staff members' lives inside and outside of work, and being able to, as Kelsey said, sift through kind of what the staff members are bringing to you and come back to them with, this is what I hear. Let's talk this through a little bit more. This is what I'm thinking that you need, and this is how I think I might be able to help you, or what we might be able to do about it. So just kind of reframing it and expressing it back to the staff member that's coming to you. I think with that active listening, listening for those key words and things that they may throw into the conversation with you, but it's not always going to go in this easy 1, 2, 3, 4 flow. That's for sure, especially different staff members, different backgrounds, different things that are going on for them and experiences that they've had. So that's a very good point.
Anyone else have any experience using this model or even adapting this model of just checking in with staff? And even in addition to successes that you've seen with this, any challenges that you've seen come up in these conversations, kind of talking through and using this model? Any challenges or any questions for your peers or even for Allie? And again, if you don't feel comfortable unmuting and asking verbally, that is totally okay. You can also put that in the chat as well, and we'll make sure that we're reading those too. So I know another strategy that was mentioned was really fostering an open door environment. And I think that that probably feeds into this model of compassionate communication as well. So for setting up that open door environment, if you do feel like your leadership team has created this at your facility, what did you do that kind of helped staff feel comfortable coming to you as leadership with those questions and concerns? anything that you did in particular that kind of helped staff to realize that they can come to you, anything that you did to set up that open door environment? And I think this open door strategy, it's definitely important when we're talking about well-being. I think probably too recently it's been really important in relation to COVID-19, everything that's going on with COVID-19, everything that's going on with the vaccinations and booster vaccinations. I think residents and staff alike probably have a lot of questions about that. And so I could see that open door policy being really helpful. So is there anything that you've done to set up that open door environment where people are coming forward with those questions, even about COVID-19 vaccines? Anything that anyone would like to share?
So Julie, I'm happy to provide kind of a quick anecdote from my own experience. And I think this really ties well into Allie's comment about normalizing behaviors, right? So I can say till I'm blue in the face, I have an open door policy, but if every time someone walks through my door, I can't look up from my computer screen, or I'm only half listening, or I'm busy doing something else, that tells you you're not really welcome. You don't have that you don't have my full attention, that what you're saying isn't important, even if that's not what I am intending to betray, right? So I think really being cognizant and aware of making sure that your actions and your words match. And when someone walks into your office, as hard as it can be to drop what you're doing and focus for 5 or 10 or 15 minutes, I think that like little tidbit of time really goes a long way in helping to build not only that personal relationship, but just foster that community and that environment of knowing that I am approachable, I'm interested in what you have to say, I'm here to help you, we're a team, and we want to build that environment. And so, that's something that I always try to be mindful of when somebody walks through my door is whatever I'm doing, just take a deep breath, step away from it, and give that person your undivided attention. Obviously, there's instances where that just can't happen, but that's when, again, you can just shut your door and ask for, 10, 15 minutes, an hour to get through what you need to get through, and then, open it again.
And we do have a comment in chat too related to that from Lynn, who said being accessible when out on the floor is a good place to start. Also, staff feel they can talk to you freely while they're making a bed or running the dishwasher. That makes them more comfortable in coming to your office with a concern. Listen to the concern, thank them for communicating with you, that concern to you, and then act on it, as we've said before.
I was just going to add that I think Lynn's comment is very appropriate. It's more than just having the open door policy. It is walking the floors. It is going to see staff. It is attending huddles and shift reports. And the more they see that you're concerned and available to them, the more that you'll build that trust with them. I think also it's important to let them know when you can't do something about what they request. It's the same with residents. Some things you have control over, but some things as an administrator or a director of nursing or leadership, you really don't. And letting them know, though, that you'll keep that request or that thought and make sure that you continue to bring it up, but it might not be an immediate thing that you can respond to. I also think of all the things that have been brought up today and all the good suggestions. It's really important, as Ellie mentioned somewhat too, to ensure that leadership staff have the support they need and that you've got someone that you can talk to about the frustrations and for your own mental health and support, where you feel limited and where you can get support from to continue to do the job, because I think that's one of the reasons we see such a high turnover in leadership positions in long-term care is that we don't have that structure of support. So it's important to develop it for the staff, but it has to go beyond to the leadership also.
And Kathy, I really appreciate you raising that point specifically about giving a community to our nursing home leadership. And really that was sort of the intent of this meeting precisely, because we recognize that so many of our nursing home leaders felt isolated. It was the admin, the DON, the two of them, maybe an infection preventionist, but they were really leading a lot of the COVID work. And, you know, perhaps they were part of a larger system and had other facilities to kind of network with. But a lot of this was very isolating, and everybody felt like it was us against someone else and we have to do better. And we just wanted to offer this forum for you to network with one another and understand how different facilities and different people are doing things, and really just give you that support, because we know how critical that is, not only to your well-being, but to that of your staff, your residents, your facility as a whole. And so Kathy, I think you raise a really great point with that.
I think that point of making sure that leadership is supported too really also relates to what Allie was mentioning earlier about ways that leaders can take time to care for themselves during the day. So just wondering from all of you too, what are some of those ways that you do this or you encourage your staff to do this? I know Allie had mentioned taking a lunch. I feel like that could be great for being accessible during the day too, for any staff conversations that come up. But any ideas, anything that's worked well about taking time to care for yourselves? And I know we had mentioned some self-regulation activities. So taking a 5 to 10 minute walk, starting meetings with deep breathings or sharing stories, just taking some time to laugh together. Has anyone implemented that at your facilities, or maybe is that something that you're interested in starting? I think sometimes days can become so busy with all of our to-dos and what we have to do. So if you have any ideas, maybe it'll help with brainstorming for somebody else on the call. So anyone would like to share, ways that you take some time for yourself during the day? And again, if you don't want to share verbally, totally fine. Go ahead and drop things in the chat too.
I think, again, we've got some good suggestions here. We also, one thing I did in the facility I was in was we created safe places for people to go. Like you couldn't always leave the building or just walk out. You know, you have to ensure that someone else is watching those people they have responsibility for, but creating that environment where it's safe to do that, where you can turn to a coworker and say, I need 5 minutes, I need 10 minutes. And then we created places around the building where people could go. We had a backyard patio, which was not heavily used by residents. So that was a good place for staff to go. I let staff use my office and told them that they could come in whenever they needed to, and anything they wanted to say, they could say and it would stay there. You know, sometimes we just need a place to blow it off. And I would do it without being, if I were there, I would do it without being judgmental, but they could always go into my office and shut the door. And if they needed to scream or swear or whatever they needed to do, it was okay to do that. You know, there were places you could do that, not in front of the residents, but you know, there were other places. So we talked about ways that you could give each other space to deal with what you need to deal with. And I think that's probably one of the biggest keys. And I'm sure other places have lots of ideas of how they've allowed that personal need space.
Yeah, thanks, Kathy. I think those are two great suggestions, having places to go where multiple staff members can kind of take a little bit of time away, and then places where people can go individually and have a conversation. So thanks so much for mentioning those. I think those are two great suggestions.
One of the other strategies that we've deployed is called the 3 good things. And I don't know if anybody on this call is familiar with that, but it's sort of grounding in helping us get out of potentially a chaotic mind space or stress when we really try to shift our focus and identify what are 3 good things that have happened to me today, whether it be personal or professional. And so a lot of times what we find is that by sort of shifting our mindset from the chaos of whatever's going on around us in the facility, at home, that really just trying to hone in on what is going well can really help us get out of that mindset and almost reset how we're feeling, thinking, and kind of moving forward with our day. And so this 3 good things program actually came out of the Duke Center for Healthcare Safety and Quality. And so it's actually part of a larger program, which is ongoing right now. As a matter of fact, that's a 10-week little mini course on bite-sized wellness for our well-being and resiliency. We're in week 4 this week, but all the sessions are recorded. So if that's something you're interested in, feel free to check it out. I've dropped the link in the chat there. You feel free to register to join the sessions, but I've found that these have been really helpful in just providing some other tools for ways that, you know, we can sort of build that resilience, shift our mindset, and really be intentional with how we do our work and kind of go about our days.
Thanks for sharing that, Kelsey. And I think that mentioning good things too, it makes me think about what Allie was mentioning about celebrating the positives, and even just taking time to connect with people on a more personal level. You know, those good things, they can be professional, maybe they're personal. So just wondering if anybody has ways that their team is celebrating the positives. So are there fun or creative ways that you all are celebrating birthdays, or if someone has done a good job with something that week, maybe if a team collaborated and there was really great teamwork, are there ways that your teams are kind of celebrating those positives?
I know in most long-term care environments, when there's holidays, whether they be big or small, the activities or whatever you call them, life enrichment in some areas, really do make a very conscious effort to celebrate with the residents and throw a party or, you know, have a birthday party for those that have birthdays during the month. I know that the facility that I worked in did things like that, and most of those are geared towards the residents. And so myself as the administrator and my fellow administrative staff members really wanted to make a conscious effort to celebrate those different days or times of the year with our staff as well. And so we would gather as a little committee once or twice a month and kind of prepare for the future days of the year or the different holidays, or look at the birthdays of the entire month and kind of come up with some creative and fun ways to celebrate with the staff too, because our staff are in long-term care are there as much as, you know, some of our residents are there. Our staff are there over nights, weekends, and holidays all the time. And so it's really, really good to be able to celebrate those different, you know, milestones or fun days of the year with them too. So I know that is one other way in the building that I served in that we celebrated those fun times of the year with the staff too.
That's a great idea, Allie. Yeah, for both residents and for staff. Anyone else want to share any creative ideas they have for celebrating those positives? Maybe get some brainstorming going for others who want to start celebrating some holidays or birthdays or just good things that happen for residents or for staff. All right, well, hearing none, thank you all so much for the discussion. I think we had some great suggestions too. We want to take a few minutes too, just to open the floor if anybody has any other questions they'd like to ask or anything else that they'd like to discuss with the group. We'll go ahead and open that now. Feel free to unmute yourself and ask, or you can always drop that in the chat as well.
All right, well, hearing none and seeing nothing in chat, I won't belabor this call. If there isn't further discussion to be had, we'll close just a few minutes early today. I want to thank you, Allie, for joining us and sharing your expertise. Thank you to all of our participants as well who joined today and continue showing up week after week. We will go ahead and close this call. We will see you back next week, and we'll be having a discussion about the second booster shot that was recently approved. So bring your comments, questions about that, and we look forward to seeing you again next week.